Hey everyone, and welcome to the AVPN Gender Agenda, the podcast where we dig deeper into the stories, systems, and change makers reshaping gender equality across Asia. I'm Kelly Latimer, and today we're going to be talking about an issue that affects every single woman everywhere and yet still sits at the margins of public health planning, and that's women's health. Joining me are two leaders who have dedicated their careers to changing that. We've got Olivia Cotes-James, founder of LUÜNA and Good Period, an absolute driving force behind menstrual equity across Asia. Also with me, Shruti Lohia Hora, Director of Indiarama Healthcare and champion for accessible maternal and child healthcare across India. Today, we'll be exploring why women's healthcare continues to be siloed, the cultural and systemic blind spots that keep care out of reach, and what real gender-responsive solutions could look like. So let's dive into it. Ladies, hello, welcome. Thank you so much for joining us on this episode of the AVPN Gender Agenda.
Thank you for having us.
How are you all doing today? I mean, it's so good that we've got you here today, and we're really, really happy for you to be able to share. But maybe before we start, could I get you to just start by telling us a little bit more about how you got into this space and why it's so important to you? Shruti, we'll start with you.
Thank you for having me on this podcast. It's great to be here and discuss on women healthcare. So I moved to Singapore 17 years ago. I had my first child in Singapore, who's now 17 years old. And today I've got 3 beautiful kids. We're all Singaporeans. And I met my pediatrician back then, 17 years ago, and Dr. Kumar, who practices at Kindra Medical Group. So I've known him since the time my first daughter was born. And back in 2014, I was expecting my 3rd child. I happened to just walk into his office, one of the appointments that I had, and I see this beautiful picture of this hospital in his cabin, which I've never noticed before. Started talking to him that, where's this hospital? And he mentioned about starting something in India with this woman and child 100-bed hospital, which he set up in Kerala, Cherthala, Kochi. So we decided to sort of talk more about it. And I decided to have a meeting with him offline and say, you know what, Dr. Kumar, this is a great hospital. It looks beautiful. The pictures, I would love to talk more about it. And interestingly, back then, I was trying to figure out what I want to do in my own life. I was already in the medical field. I was running medical glove facilities in Malaysia. We have factories where we manufacture examination gloves. So healthcare was already part of my DNA, and I was still exploring new opportunities. And I was at a point where I wasn't really happy where I was. I wanted to do something different. I wanted to make an impact in India, especially because I am from India originally. I was born in Jakarta, Indonesia, but my parents are from India originally. I used to visit home all the time with my grandparents being there. And yeah, I just had this chance of meeting Dr. Kumar and working with.
Isn't it amazing how sort of like life puts you in situations, scenarios where you suddenly feel like, okay, this is my calling. This is what I'm meant to do. And obviously you've gone on to do great work as well. We'll come back to some of that work in a while. Olivia, what about you? Set the scene for us. How did you get into this space?
So I've been talking and thinking about periods every single day, 24/7 for the last 10 years. And my journey to where we are today is kind of summarized into, I think, 3 chapters is how I look at it. The first is grassroots community building and research that then led me to the second chapter, which was the launch of my first company, my brand, LUÜNA, which then evolved into the 3rd chapter, which we are living today, which is the evolution to our new social enterprise, Good Period, which I'm really, really excited about. And so to quickly walk you through those 3 chapters, I'll take you back to 2016. I always describe myself as an accidental entrepreneur, and I think that's really important because I really feel like my story should be inspiration to anybody that doesn't have entrepreneurial background, a network, or access to funding, and proof that even if you don't have those things, that you can do it. But nonetheless, in 2016, in my mid-20s, I was living between Hong Kong and Shanghai. And with no intention of starting a business, my eyes were just suddenly opened to the absurdity of the status quo around menstruation. So by that stage, I'd been kind of struggling with symptoms for over 10 years. And just through a couple of eye-opening natural interactions with actually colleagues at the time, I suddenly realized that it's not okay. So many of us are struggling with this issue in silence. What that led led to was then working with a friend of mine. We started advertising on social media for strangers to come and meet us after work and on weekends to talk about periods. And very quickly, it might not surprise you to learn, we got known as the weird period girls. But the thing is, people turned up. At first, just 5 or 6 people. But then over the course of the next couple of years, this community evolved into a community hundreds strong, even doing collaborations with brands like Nike in Shanghai, who saw that we were creating something special, a place where women could come together, not just to talk about periods, but talk about all the other areas of life that were important, but under-discussed and still very, very taboo. And it was through that community that I saw that no matter where someone was from, what age they were, their background, or their experiences, we were all united in the same fear, shame, and confusion. And not only that, I came to then realize that the period products that I was using contained plastics that I was not aware of. And even worse, I realized that those plastics were causing the decade of yeast infections that I had experienced and blamed on my body. So it was at that point that I realized a community would remain important, education would remain important, but that a brand with physical products was needed, products that were better for our body and the planet and delivered through a brand that stood for more than just selling products. So in 2019, I'm skipping over, obviously, a very steep learning curve here of going from community to product development and manufacturing. But nonetheless, after raising a small seed round of funding, I launched LUÜNA, a brand, in 2019. And that was also a steep learning curve, but we had a lot of early successes. We were the first disruptor brand on the shelves of mainstream retailers in our markets. We won awards, we got great media coverage. But a couple of years ago, I started to realize that being on the shelves of retailers was not the reason we existed. We didn't want to just shift an existing blueprint. We wanted to change how society treats menstruation. And so we started pitching to large corporations and schools to provide our products in their washrooms for free, as well as delivering gender inclusive education to employees and students. You know, very difficult to get any interest back in 2019 on those proposals. Very much met with opinions we still hear today, unfortunately, but less so. Why would we do this? This is so inappropriate. We wouldn't talk about menstrual health in the workplace. But over the years, we persevered. And today I'm pleased to say that we are in over 3,000 washrooms across Hong Kong and Singapore, working with the world's largest organizations from HSBC to Cathay Pacific and other local smaller organizations to make sure that menstrual health is supported in the workplace and in campuses. And it was really that work that led to the launch of Good Period earlier this year. And LUÜNA will continue to deliver its healthy and sustainable period products. But the model around Good Period takes all of those years of learnings and encapsulates that in a model that we truly believe will end urban period poverty in our lifetime. So we have created a program that works with these large organizations, not just to put period products in washrooms, but really certify and hold them accountable to certain standards to support menstrual and eventually women's health in the workplace. And we use the majority of profits from that work to fuel our community initiatives that provide not just pads, but specifically reusable period products and education to vulnerable communities in the cities where we operate. And through this, we really think we've got a good shot of ending urban period poverty within our lifetime.
And I think when you go on to that note, I think it just segues very nicely into what I wanted to ask you both, which is, what is it, do you think, that still makes women's health such a silo? Why are we still not talking about it? We see how we are currently, in most areas, in a progressive state. Why are we still, and why is women's health still overlooked in women's health planning?
So currently, Kinder Women and Child Hospitals, which is our current brand name for our hospitals, we operate mainly in Kerala, and we have 6 hospitals. And one issue that we faced is that in India, the troubling aspect is the gender disparity in the healthcare system, which is not really talked about much. Just some statistics to share with you. According to the National Family Health Survey, only 12% of women aged 15 to 49 make decisions about their own healthcare, while 34% of men are making more decisions on healthcare for themselves. So that itself is a huge disparity in India. And Kerala, especially, the women are the breadwinners. So in that situation, women really have the opportunity to take care of themselves, while the men are the ones who are managing, taking care of themselves even more than what the women are, because they're just too busy taking care of the family. And one of the most important programs that we have is we provide a lot of free insurances to women. So we are encouraging women to get empowered. We are getting women to sign up with insurance companies so that they could take care of themselves. So this is one big issue that we find in India. Boys and men are likely to receive treatment more than women, which is an issue India is facing.
And how do you think we change that then? Because that's obviously a big problem. The fact that there is gender disparity even when it comes to who gets access to healthcare.
I think the best way is to educating women through a lot of programs. So a lot of the hospital, I don't know about the other hospitals, but at least in our hospitals, we do a lot for the community. Every month we have initiatives driven around women where we're encouraging them to come forward, come to us for free surgeries as well for those who can't even afford them. So it's all about the women empowerment, which we focus on aside from our general hospital services that we give.
Olivia, what do you recommend? Because obviously within the menstrual space, you mentioned just now, people don't really want to talk about menstruation in the workplace. And to be fair, even in schools, on campuses, it's a little bit awkward, slightly embarrassing. But as a mother of a young daughter and a young son, I want to create a space for them where they don't feel like their needs need to be ignored. And don't want my son to grow up not acknowledging the fact that his sister will have her period. I want him to be the boy that offers his sweater to a young girl because he understands that period is not a bad thing, it is a part of life. So how can we change that, and why is it still being overlooked?
And I want to say thank you to Shruti for answering it and talking about the existence of these deep-rooted disparities in healthcare. It's not specifically the space that we work in, but obviously it's so interlinked with the work that we do to shift stigmas and drive education around women's health. So building on what Shruti said earlier, I'd like to talk more about the lack of education, which is one issue that we face. And what we see is we work with so many diverse groups through the work that we do at Good Period. One morning, we'll be in a corporate office talking to a room of bankers. Later that day, we'll be delivering an educational program to our community of overseas workers. And what is ever present in all groups that we work with is this lack of education. It is false to say that certain groups are better educated about menstrual health from what I see. Let's take that group of bankers that I mentioned. Still in that room, I always say this in reference to the education that we get at school, people will know more about the biology of a plant cell than they do about the bodies of half the world's population. And you put it perfectly just then. This is not knowledge that only half the world's population should have. It's knowledge that everybody should have, how the menstrual cycle works, how different phases of a woman's health will evolve through time in order to build the right empathy, support, and in a world where men are still predominantly the decision makers in these industries that matter, the ones giving us funds to invest in healthcare innovation, making the workplace policies in the spaces that we live and exist in every single day, men need to be educated so that they can make these changes. What I'm hopeful about, despite obviously this lack of education and its consequences creating despair on some days, I'm hopeful that for the most part, when given the right education, everybody, men included, are very eager to act. For example, enlightening a room full of male leaders that over 90% of women in the corporate workplace in Hong Kong have at some stage had to use toilet paper to manage their period because period products have just been overlooked in a workplace that has a pantry full of awesome snacks and fizzy drinks and so on. As soon as a male leader, for the most part, understands this, they are quick to act to change that status quo. Or when people learn about the existence of menstrual-related conditions like endometriosis and PCOS and learn that it creates debilitating pain and can lead to things like infertility if left untreated, they will do everything in their power to overcome this deeply ingrained stigma that we have all been brought up with and do something about it, even if it's uncomfortable for them. So for me, it's not an easy shift. As Shruti said, there are these deeply ingrained disparities that link to so many other interlocking inequalities that we need to face. But I think that better education, getting into these rooms, especially where decision makers, and giving them the right knowledge that appeals to their empathy and their human logic, I think I've seen to be very, very powerful and create some strong positive impact.
So moving forward, where does this education responsibility lie then? Because I feel like there is part onus on parents to raise children such that they understand these issues. But then when you talk about the actual education systems themselves, you talked about how you will know more about a plant cell than you will your own body, right? Is it at a school level that we need to be changing this and spending more time and putting more emphasis on this? Or is it adult education whereby people have sessions that they can sign up for in the workplace or in university campuses or community spaces and things like that, that we can really try and change that? And I guess within the healthcare system, well, Shruti, I guess this applies here as well. Is it something that maybe hospitals could do to fill the gaps, to come in with that education and knowledge transfer? Because I feel like despite the fact that we're living in this very modern world, there is still a lot of stigma talking about our bodies, how we feel, what's going on, and the impact of what we go through, whether it's specifically with regards to a period or whether it's with regards to women's health in general.
Yes, so for us, what's really been effective is that all the patients who come in, we extend extra additional services as well, where you're not just a patient in a hospital, but beyond the hospital. So we have monthly Zoom sessions on certain topics around women where we discuss how they should take care of themselves. Again, this is all about empowering women, educating them in terms of taking care of their health, including their children. At the same time, we feel that the community impact is really big. We host a lot of events throughout the year. For example, one of the big events that we host is the world's largest pregnant women fashion show. This is something which has been happening since the past 4 years
That's
now.
amazing. I would have felt anywhere. I was a beached whale when I was pregnant. I don't think I would have been able to walk a runway.
No, it's been a great event for us. The women who are not even pregnant yet want to become pregnant, that they can be part of this fashion show. It's great. Women are made to feel good about themselves, even being pregnant, and they should be. It's such a beautiful state to be in. And the whole idea is to showcase these beautiful pregnant women who are going to deliver miracles. And at the same time, within Kerala, we have the largest cake mixing program. So we have the biggest cake that is made every year. All the pregnant women come, expectant mothers come together, and they do a cake mixing ceremony. And they enjoy this beautiful, huge cake in our premise. And all of this actually is something started off by myself and Dr. Kumar, who's my partner. So as I mentioned, we have one hospital in Bangalore and 5 in Kerala. Kerala is our biggest focus at the moment, and communities in Kerala are amazing. We love working in the state of Kerala. The people are amazing. Just even the team that we have out there, they are so empowered to do so many creative programs where they're really reaching out to all the nearby communities, getting women and children to come forward and take care of themselves. So this is something which we are really focused on, and we've definitely seen a big change within the community.
I think there's definitely where you've got different community-based stuff, things that are coming top down from the hospital as well. But then, Olivia, what about you and where do you see yourself filling in? Because, like I said, so many points where I feel like we need more education.
Absolutely. I mean, I love those examples that you shared, Shruti, and also the fact that these aren't necessarily one-off, one-year only creative activations. They've built this culture around them. I think that's incredibly impressive. This is less about education, actually, but still links to the broader conversation that we're having. But I think education is one thing, but also normalization. And I think that's so beautiful about that fashion show idea, Shruti, that you just told us about, because you don't see pregnant or postpartum bodies in certain places in the world anymore. And I know from, following brands that I love, still when they try, the backlash is horrendous, which proves that the world does not feel like women's bodies, or women's bodies are only appropriate for certain spaces when they look a certain way or are functioning a certain way. And I feel the work that we do, aside from the education, just the visibility of having period care dispensers yes, in women's washrooms, but also in gender neutral washrooms. And, for organizations that are catering to trans experiences, which is really important, other washrooms, men's washrooms as well, having these visible signs that our bodies are cared for and are appropriate and worthy of support and investment, I think is as important to go alongside these potentially more complex educational programs as well. These are small things sometimes, as well as larger activations and campaigns that we can do. I talk about everyday activism, as we always get asked at the end of our corporate workshops, like, what can I do? And in response to that, we talk about everyday activism, which is whether you are a man or a woman, talking at a normal volume about menstruation. If you're a man and you don't have your own personal experiences to bring to the table, referencing a bit of news that you saw about menstrual equity, just as you would any other piece of news, and demonstrating that you are paying attention to the need for shifts in these areas and showing that you're an ally just by simple act of using your voice in everyday conversation.
So then, if you ladies could redesign a healthcare system from scratch with women at the center of it, what's the one thing that would be different? Because I feel like there are so many facets of things that we're like, oh, there are elements in terms of the focus, and elements in terms of exposure to care, elements in terms of the education and what have you. But what's the one thing, if you were to start from scratch, that you would be like, no, this has to be our core focus?
I think one issue that we face today is that we don't have enough in our hospital for women and children. We have a lot of multi-specialty services as well that we provide, but there are certain services, for example, like cancer treatment, that we are not providing yet within our hospitals. And I think this is a big issue that we're facing. We're seeing with children as well, and women who are going through a lot of cancer diagnosis. This is something which I would love to have in my current hospitals. If I were to start something of my own, I would start up with that, having that cancer specialty hospital as a separate wing to what I have currently. So this is, I would love to add on to what I have if I were to restart again.
Because I feel like there's still that element of whenever studies are done, and I think maybe this is what I would change or I would want to see different. There are so many studies that are done which are studies based on how men react to certain medication, how men react to a certain protocol. And if you look in the fitness space, for example, it's sort of like, oh, fasting is great for you. And then they realize, oh, actually, it's not as great for women in certain scenarios. Oh, ice baths are fantastic for you and you should be doing them every single day. Oh, you do a little bit of digging and actually ice baths are not so great for women, and there's actually a particular temperature that we need to be looking at. So I think for me, what I would love seeing is when it comes down to all these studies that are being done, for these studies to actually also be done on women and seeing the actual gender difference in terms of the cause and effect of it all. Like, there is a big difference when it comes to actual females. And I'm sure it would be the equivalent of trying to say, yes, let's test a period product on a man. And it just doesn't work. Like, you can't do that sort of thing, right? So I think for me, that would be the shift that I would want to see. Olivia, would there be any like policy changes, cultural shifts, then anything like that that you would like to see done?
There are so many ways I could answer this question. I want to answer this with my founder hat on, as somebody who has raised investment, tried to raise investment, and has many peers working in the women's health space who also have struggled to raise funds. I would like to see a more representation of women in the VC investment world, decision makers at the top, deciding where funding goes. Because if the status quo in that industry was different, we would not live in a world where investing in solutions for women's health, despite the fact it supports not only half the world population directly, but the entire world indirectly, yet these solutions are still seen as too niche. So for me, a world that better supports women's health is a world where access to funding for these solutions is improved. And that requires an entire other industry to look very different.
And I guess to remold that sort of viewpoint as well, and to have people talking about things in different ways, what role do you think that funders, philanthropists, networks like AVPN, for example, what are they going to play? What role are they playing in transforming women's health, do you think?
these two things very much intersect, but an equal measure to having menstrual equity is, my life's work, my mission. I'm also very passionate about reshaping the paradigm of business, the role business plays in this world, and talk a lot about the traditional paradigm where you have your businesses existing for profit and then your incredible NGOs doing the good work. And I believe solving the world's most pressing environmental and social challenges requires a shift in how we approach business. And so a lot of what we need to do, and Shruti, I'm sure the same is said for you, is we can't just come in. And I used to be really bad at this because I was just at the early stage of my journey with this. I didn't quite appreciate the nuance of kind of coming in and speaking the language of business. I very much led with like, this is the right thing to do. And it didn't get me very far. A lot of what we do now is obviously having to make a very strong business case for investing in women's health. And so maybe not all of those stakeholders that you just mentioned, everyone has their key areas of focus. But I think that I would like to see women's health founders and women's health companies coming together to figure out like, how can we show that there is a strong business case for these investments? It still sounds awful coming out of my mouth sometimes, because obviously this is the right thing to do, but how can we show and being able to tell that story collectively as an industry, as a community? Because that's when we can move the needle on not just investment, but also in my work in corporates going, yes, we're going to invest in your solution because it reduces absenteeism, increases retention, and so on. So I think working together to put more data and a stronger kind of commercial case around the work that we do would help all of us collectively.
I think so. What about you, Shruti? What do you think? What sort of role do you think these individuals and corporations and people, networks, organizations, what do they play in transforming the space?
I feel that chapters like AVPN are doing a great job in raising a lot of awareness towards different industries and women as well. Women empowerment is one of the biggest awareness campaigns that they work on. It could be from healthcare to work, the different facets of a woman that are neglected by society. Gender disparity. There's so much out there. So one thing I feel that we can get private enterprises to come in and do more, as mentioned, maybe set up more individualized programs, create synergies with other hospitals as well, even other NGOs where we can work together. Like, for example, I can work with other NGOs as well. I have my own trust that actually we have formed the Kinder Trust, where we offer a lot of surgeries, free insurance for women, but again, it's not enough. So NGOs like AVPN, we can work together and create more awareness in other states. And again, other private enterprises can also come in with their own trusts or their own programs and work with us. It's all about the networking. I feel like we need to create a stronger platform where we can just be like, oh, hey, you're doing this. Let me come to you and work together on this part of empowering women.
And I think it's really important then to also focus on sort of like the element of collaboration and making sure that everybody understands that whilst you're working on your own little thing, I mean, both of you individually working on two very separate things with regards to women's health, but at the same time knowing that there is still opportunity and avenue for collaboration. So just winding things then, I want to ask you guys two more questions. The first one, what is the one women's health myth that you want to debunk?
So mine would be that women's pain is normal.
Yes. Oh my goodness, that's such a good one.
Just briefly exploring that, particularly in the work that we do, we know the long diagnosis times surrounding what are actually very common women's health conditions like endometriosis, like PCOS. And one of the major contributing factors there is the belief that women's pain is normal and it's just something to grit your teeth and bear, which means women are dismissed by doctors time and time again. So it's important.
There's a lot of part of a woman that is not understood. We are strong women generally, but there's a part of us which needs a lot of focus.
It's almost like
Women are taken for granted. I think that's what it is. That's the bottom line. Women are taken for granted, which is something I feel is
really important. It's really important. And I don't like ending things on like doom and gloom, right? Because it's not. There's so much positivity that we can look forward to. And I always believe in bringing solutions, not problems. So we can talk about all the things that are wrong, but you ladies have given us some solid cases for what could be right, what you guys are doing to make it right. And maybe outside of the work that you are doing specifically, what is it that gives you hope about the future of women's health in Asia?
For me, it's what we see within the student communities that we're connected with, the amount of groups, gender diverse groups of young people who are in their time outside of school and their studies working on campaigns and projects to reduce inequalities around women's health and break these stigmas that have been so ever present in our own experiences and the generations before them. So every time I get to work with young people, I leave that room feeling more hopeful.
Wonderful. Shruti, what about you?
For me, it's the women communities out there coming together and helping each other and empowering each other. I think when we all come together as groups or at a bigger level, there's so much hope that brings with it. We are able to do so much more and just work collectively, which really makes a big difference.
Well, you know what, ladies, you guys have given me so much hope for the fact that women's health isn't being ignored in its current state, the fact that things are already being done. And I'm so grateful for both of you, for the work that you do, for what you're championing, and for everything that you see looking forward as well. So thank you very much, Olivia and Shruti, for sharing your experiences, expertise, and visions for a healthcare system that finally sees and serves women as well. So for those of you who have tuned in, thank you so much for joining us for this episode of the AVPN Gender Agenda. If you found this conversation meaningful, please share it, subscribe it, and also help us to amplify these very important voices and the messages that they carry as well, because change does not happen in silence. Until next time, stay curious, stay vocal, and stay committed to shaping a more equitable world. Thank you very much. We'll see you again. Goodbye. Thank you for joining us on this episode of Gender Agenda. Find out more about the Asia Gender Network powered by AVPN, Asia's largest network of social investors, at avpn.asia. Don't forget to follow and subscribe. We are on Spotify, Apple Podcasts, and YouTube.